and welcome to the Lezlie Show. We have a really great show today. We're going to be talking about regenerative health, which includes stem cell surgery. So we have Dr. Matt Egbert, so stay tuned. It's going to be very informative. Welcome, Dr. Egbert.
Thank you.
It's a pleasure having you on the show today.
Thank you. My pleasure to be here.
I think it's going to be really interesting. So today we're talking about restorative, regenerative health.
Yeah.
And so if you could explain a little bit about that.
Sure. Let me give you a little bit of my kind of backstory of why I decided to do what I've done. But the regenerative medicine is a big topic. We'll talk about that more. My vision and my goal for creating a practice has been to try to alleviate some of the challenges that I had when I was young, which was many different doctors with different opinions and not speaking together, not getting the full story from one provider or getting a difference of opinions from different providers. And so I wanted to create a practice that has multiple specialties all working together, and so that we can have a real dialogue between providers. And when we talk about regenerative medicine, we're looking for things that are non-drug and non-surgical approaches to helping people recover from injuries that they have.
Okay, and I think you were telling me that you have some type of, is it a shot, an injection you give people with, is it different types of medicines or is it herbs, or if you could explain that a little bit.
Sure. So when we're talking about regenerative medicine, there's a few different things that are available. And some of those things are PRP injections, which stands for platelet-rich plasma. Another one would be a stem cell injection or a stem cell allograft. You can get pretty deep into the science on this stuff, but there are different things that can be injected into you to help your body make its own repairs without using surgery, without using drugs. Does that make sense?
Yeah, that does. And I wanted to have the show because I don't think a lot of people know about this. I think the average person thinks I need to go to a surgeon. My arm, my shoulder's killing me, or my knee's killing me.
Right.
I've got to have surgery. But there's stem cell out there. And anyway, stem cell. Let's talk a little about stem cell because I know that can be a little bit controversial. So
sure.
Explain to us exactly what stem cell is.
So stem cells are a type of cell that exists in your body. We all make them. When a fetus is forming, most of those cells are actually stem cells. And so those cells are cells that are kind of the blueprint to become other things in the body. So you can have a cell that might become a hair cell or a skin cell. It might become a liver or bone or different things. And those kind of blank template cells that can become other things are what we call stem cells. Mm-hmm. So when the fetus is forming, of course, you need all of those different body parts to come from the original two cells, from the mother and the father. And then those cells divide and become all the different parts of the body. So our body creates these stem cells to repair different things. When we have a cut or we have a fracture in a bone or something like that, we have tears in muscle cells. It's the stem cells that help to repair those damaged tissues. Does that make sense?
Yes, it does.
Yeah.
It does.
So when we are very young, we have a lot more stem cells in our body than when we're older. And that's a big part of why someone that's young heals very quickly. Let's say a child, has a broken bone or something like that. They might heal in several weeks. Whereas someone my age might take a bit longer, and someone older than me will take even longer still, even up to 12, 14 weeks if you have a fractured bone. But a child might heal in, 3 weeks or something similar to that. And part of that is because they have so many more stem cells available that when you have an injury in your body, that injury produces certain chemicals that draw the stem cells to the area to start making that repair.
Okay. So how would the average person know whether to get the surgery or to have the stem cell? Mm-hmm. How would they, and is it cost effective, or does the health insurance pay for that, or how does that work, the billing part of it?
Yeah, great question. So working with your medical provider is critical for this. Because the regenerative medicine therapies are newer, the research is new. And so having that as a new option, it takes a little bit of time for your medical providers to understand the research and be exposed to it and get to the point where they can recommend something like that. And it may very well be that not everyone will be a candidate for regenerative medicine. That may not be the best option for people. Some people may require surgery for things. If you have a muscle that is completely torn in half, there's probably not something you can inject in there that's going to make that rejoin. So you might need some surgical procedure for that. But if it's a partial tear or something like that, or it's a degenerative condition, some arthritis in the shoulder that has developed, or the knee or the hip, those kind of things have responded very well to regenerative medicine. The way that works, the science behind that, can be a little controversial for some people. Probably the biggest question, the most common question that people have about it is whether or not they come from ethical sources. Some people think that a stem cell might come from an aborted fetus, which is illegal in the United States, and I personally would never recommend something like that. So they come from tissue donations from healthy full-term babies that have been donated by the mother and father. And there's lots of different types of stem cells that exist. The ones that we want for joint repair are called mesenchymal stem cells or mesenchymal stem cells. And the best source that we found in those is actually the umbilical cord matrix. So there's this kind of jelly substance that goes around and surrounds the umbilical arteries and vein. And that is very rich in these MSCs. And so if we can harvest those, we have the best type of cell for repairing things like arthritis and other degenerative conditions. That's the goal of using those stem cells. And so it can be a little bit controversial because people think that it's coming from an unethical source, but the ones that are used in this country either come from the patient themselves or they come from a tissue donation. The difference between those two is that if you harvest your own stem cells, which can be done from your own adipose tissue or your fat cells, or it can come from your bone marrow. But you have to make sure that you're getting the right kind of cells into the right area for the repair. And what has happened in some clinics is they've used stem cells that are going to become blood type of cells. They're called hematopoietic stem cells. And they're trying to use those in areas that the FDA has said are not approved. So they've used a blood type of stem cell, or a cell that's going to become a blood cell, to try and repair a knee. And in some cases, they've even injected those into the eye of patients, which has had some poor results. So that's where the controversy comes about. But once you understand the science and you're using the very best practices to make sure that you're avoiding harming the patient, it can be done very safely and very effectively.
How many years has this been out?
So the earliest research or the earliest publication that I could find was from 1913. 1913.
My goodness, really?
Yeah, a long time ago. And so it was actually this doctor that found, and he published his results in the Journal of American Medical Association. He found that he was treating burn victims in a hospital. And so people were having these terrible burns on their skin, and the standard of care was a skin graft. So they would take skin from another part of the body and then lay it on those areas to try and repair. Of course, now you've got another area in your body where you've removed skin from. And back in 1913, infection control wasn't as good as it is now, which still isn't very good, by the way. So this doctor decided he would try using the amniotic sac after a baby was born, which has got some stem cells in that amniotic membrane, and he would simply lay that on the burns. And he reported that the people were having much better outcomes than with skin cells, or than with skin grafts. So that's the earliest that I could find, 1913, that they were using them.
Interesting. I was thinking, I read somewhere that people are having the stem cell for their face instead of plastic surgery, that they're doing cosmetics with stem cell. Is that right? Or
yeah, it can be. I'm not sure. We don't do that in our office, but I know that it can be done for that. One of the things that can be done for that, which is done pretty commonly, is they use a PRP injection. And PRP injection is slightly different. PRP stands for platelet-rich plasma, and the way we use that the way we get that is we do a blood draw from the patient. We extract, a vial of blood, and then we centrifuge that. And so it separates the red blood cells from the plasma. The plasma is full of things like growth factors and the platelets, and those are used quite often for things like hair loss or facial rejuvenation, different things like that, that other clinics are doing as well.
have you personally seen this done?
Not personally, no.
Okay.
No, we're not doing, in our office, we're not doing the aesthetic level of it at this point, but it is something that we're considering.
Okay. Yeah.
The PRP, I just wanted to mention as well, is kind of an interesting process because when you re-inject that centrifuge plasma back into an area of injury, what happens is it's kind of like a signal flare in the body to alert the body that there's been damage to the area. And so that is what calls your body's own stem cells to that area to help make repairs. That's why it's been successful for a lot of people that have used it in other areas of their body, that type of regenerative medicine.
Interesting. So how about if we talk about cost? How much would, well, you mentioned that you don't actually do the aesthetics part, but I'm curious what something like that would run for the face. Because I know women that have paid $20,000 for a facelift, and I'm just wondering.
Yeah, this is much less invasive and much less time-consuming or risky. And the cost is much, much less than that as well.
Okay.
For facial rejuvenation or aesthetics, it might be a little bit more because there's probably additional training that needs to happen with that to make sure that you're doing it in the correct area to get the results that you're trying to get. If you're injecting it just into a joint, it's not something that is going to be affecting you aesthetically, so probably it isn't as difficult to do into a joint, and those are lower cost.
Okay, so what about your knee? If you're having knee problems or shoulder problems, do you need just one injection, or do you need a few of them? And how much does it cost, and how long does it last? Is it like a forever thing, or how does?
Great questions. A little bit hard to kind of blanket response on some of that stuff. But if you are having into a knee, we see a lot of knees. It's probably the most common joint that we treat in our office is the knee degeneration, followed by hips and shoulders. But a knee, as it degenerates, you start to get the pain in there as the cartilage wears down, and you start to get bone on bone. Then that process with a PRP injection and a stem cell can range. It can range extensively across the country. So I don't know, do you want me to go into the averages of what the cost is in the country?
No, that's okay. I was just thinking, I would imagine it would be less than having an actual surgery done. So, I'm sure it would vary according to the patient. So we probably don't really need to know exact numbers, but I'm just assuming it would be a lot more cost effective than actually paying for a shoulder surgery or a hip surgery or
there's a lot of variables that can go into that, so it's pretty tough to say because it is dependent on each person's unique case and but there is no insurance coverage for the regenerative medicine. If you have insurance for other things, it can cover that, but not the regenerative medicine.
Okay. And is it painful having this done? Or does it just feel like a regular shot? Or let's just say I'm having my knee done. How long does that take? Does it hurt? Do you need pain medicine? Or what is that like?
Yeah. So I actually had about 5 weeks ago, I had my own knee and my shoulder done. So I can testify to that personally. The injection into the joint is like other injections. A little bit of a pinch when they do the injection. Because you are delivering fluid inside the joint capsule, you feel the swelling, and sometimes it can be a little bit burning and painful for just a few minutes. We use a topical analgesic or a spray so that you don't feel it as much, but it can cause a little bit of burning. In my case, it lasted maybe a minute and a half, and then it was gone. It was right after that I continued seeing patients the same day, and actually went camping that night, and was working in my yard the following day, and it hasn't slowed me down at all.
So do you mind if I asked you why you had it done? What was wrong with your knee?
So my knee, actually my femur on my right side is shorter than my femur on my left side. And because of that, my knee joint does not bear weight evenly from left to right side of the knee. And so as I walk around and do normal everyday stuff that we all do, my knee wore a little faster than you would expect.
Okay.
And so instead of waiting for that to become worse, I wanted to do the regenerative medicine, because the goal is that your body will actually repair itself, that we can repair and regrow the tissue that's in there, including things like meniscus and cartilage. Now that's the goal. There's of course no guarantees with anything in medicine, but as we use the regenerative medicine, both the PRP and the stem cells, what I had in my knee and my shoulder, that's the goal, that we want it to be able to repair and regenerate. And if we can get that joint to repair, the repair doesn't wear out unless you wear it out again.
Okay.
If you continue to abuse the joint and you have suboptimal movement there, or you're sedentary and you don't take care of your joints, it'll wear out again. But once we get the tissue to regrow, it should last.
So you just one treatment is all you need for the knee?
One treatment.
And so, and did you notice a difference right away, or does it take a couple weeks where you start feeling it, or how does that work?
Yeah, so in my case, I used to have maybe 7 or 8 out of 10 pain levels, and that would happen maybe every 4 to 6 weeks. I'd be in real pain. I couldn't bend the knee or couldn't kneel down. And since I had the regenerative medicine injected there, I haven't had pain more than a 2.
Oh, my.
And that was right away for me. That's, everybody's case will be a little bit different. We expect that you'll start to see some results within several months to a year. There's evidence to support that those stem cells stay alive or viable in that joint for up to 18 months. And so after you do the injection, there's some care that you need to do as well. You try and do the rehab with physical therapy, some exercises at home. Maybe there's some structural things that you need to alter or repair. Then we hope that your knee will repair. Okay,
great. And you mentioned you had your shoulder done as well, right?
Yeah, that was actually kind of a funny thing. I was racing one of my children. I've got 5 children, and one of them has a hoverboard, which is a 2-wheeled little balance board thing that you stand on, and if you lean forward, it moves forward, and if you lean, 1 foot back or 1 foot forward, you can rotate. So I was riding this thing. This was down in Santa Barbara, and my younger son, he's 9 now, but this was last year, he challenged me to race him. So I decided I would race and I would see how fast I could get this thing going. And as I got to the end limit of the hoverboard, it became apparent that I was not balanced well enough. So I tried to save myself, tried to save my hands and not hit the ground hard and break my wrists, and tried to do a somersault roll through it, and I didn't make it. So I landed with my shoulder straight into the concrete and separated my AC joint, which is part of the shoulder. And it gave me some limited range of motion and some pain in the shoulder. And since I've had some rehab to it, I've been stretching it and trying to strengthen it. And I also did the PRP and the stem cell regenerative medicine. I've had 0 pain.
Oh, and did you notice the difference right away?
I did. I started to gain some increased range of motion, less pain as I stretched it, and it started to respond. Now, in the few weeks that I've had the product in there, it's really too early to say that the repair is done or that it's definitely happening. I can't say with any legal certainty that the stem cell that's in there is making the repair. What I can say is my experience has been really good so far.
That's great. Well, it looks like we have a few questions from our audience members. What's your name?
My name is David C.
David C. Okay. Well, what have you got in mind? What
I'd like to ask the doctor if these athletes have these torn ACLs and these major injuries, and it takes months to recuperate from that. Is there a faster way to do that, or does it depend on the injury, how extent it is, or how do you work that?
Sure, great question. Thanks for asking. The products that we have available now, the regenerative medicine, the science that's there now has become much more affordable for the average people to be able to experience that same level of care that used to only be available to our elite athletes. If you have an ACL tear, I think that's what your question was.
Yes.
ACL tear, if it's completely torn, you need to have some kind of surgical repair there, typically. If it's partially torn or frayed, which is much more common for the average person, then regenerative medicine can really shine there, because you don't have to have the knee totally opened up. You don't have to have the incision in there to make that repair. Even arthroscopic surgery can cause scar tissue and be a risk of infection.
Well, what would be the length of recovery as opposed to major surgery?
Yeah, so typically there is no downtime, very little to no downtime with regenerative medicine. You can have an injection and continue about your normal activities right away. We do often use a brace in that case to unload the weight bearing of the knee, give it a chance to repair. But the idea is when we provide the regenerative medicine to that area, it's the building blocks, it's the scaffolding and the matrix, the cytokines, the different growth factors and things that knee needs to repair. So we're providing all of those materials that the body needs to actually make a repair rather than trying to do the repair for the body.
I see. Yes, exactly. Well, thank you very much for answering the questions.
Thank you. Great questions.
To make sure I understand, the audience understands, I realize it's for the shoulders and the hips. Instead of a hip replacement, you possibly could have the stem cell. And
Exactly.
the spine. Now, you didn't say too much about that. So as far as the spine, what is your feeling
So there's
on
a
that?
lot of really interesting things happening with research for spinal care. A lot of those things are a little bit harder to access. So if you're trying to get into a spinal disc or you're trying to get into the nerves around the disc, those are pretty delicate areas. And so to treat those, you need kind of a surgical center to do those kind of things. We don't do those in a regular medical clinic. But there's some really promising research that's coming out showing some of those things repair and responding very well to this new revolutionary therapy.
And is that pain management that does that, or who would people call to investigate this?
Yeah, there are some pain management clinics that are doing that. Also, spinal orthopedists, neurosurgeons and things like that are starting to get into that as well.
Okay.
Now, you can use it as well outside of joints. You can use these regenerative medicine, especially PRP, into areas of the muscles as well. So if you're having some really bad muscular issues around the spine, that could be the source of your pain as well. And when you inject into those areas, there's a few different products that you can use that have been giving very, very good results as well.
It sounds like it's great.
Yeah, it's a really, really interesting field where we're seeing some tremendous growth and some fantastic research that is coming out all the time, not just for joint repair, but for lots of different things. There was a study that came out recently about repairing the sense of smell in mice, still doing animal studies on that one, and repairing cardiac cells in the heart. And even I saw some research that talked about repairing cells in the pancreas that produce insulin. So people that have diabetes that are insulin dependent. So it's really, really a fascinating field to be in right now.
Wow. Well, we've only got a couple minutes left. Is there anything else you want to add today that you think our audience would be interested in hearing about?
Sure. You know, one of the things that has driven me into this field and creating this group practice approach has been the quality of outcome healthcare in the United States. It's really not as good as it could be. We in this country we tend to try and medicate our symptoms. As we develop a little bit of pain in the knee, for example, we might want to take an Advil or a Tylenol or something over the counter for it, anti-inflammatory wise. And if that stops working, we might go to the doctor. The doctor might give us a prescription strength one. If that stops working, maybe a cortisone shot. All of these things are not repairing the joints that we have. And I think it's why we spend so much money in this country on healthcare. We spend more in the United States than the other 95% of the world population combined. And we have poor outcomes. So when we look at the outcomes that we have, when we look at a study came out a few years ago that showed the United States versus 17 peer countries, same economic situations and things, we placed last. So we're consuming a lot more drugs than the rest of the world combined, and we're getting worse outcomes than the rest of the world. So this is one way that we can help people avoid those unnecessary drugs and surgery and help them recover from the injuries that they have.
And the rest of the world, are they already doing this?
There's lots of countries that are doing it, yeah.
Okay, so we're actually behind in this.
Well, I don't know. There's some great research happening in the United States, and there's some countries that are maybe doing a little bit more, but there's lots of countries that are doing less than us too.
Well, it's something to look forward to. I know my hip hurts me quite a bit. My mother had 3 hip replacements. They say I have a degenerative hip, so I thought, oh no, I don't want to have surgery. And so I'm thinking that probably would be a good option for me come the day that I ever need to have something done.
Yeah, the difference is really, really stunning. The amount of recovery that you need from a simple injection is almost zero. Versus when you have a major joint replaced, you've got months typically you've got months of pain and rehab and risk of infection and different things like that. It's really a totally different ballgame.
Well, this is great. I'm so excited you're on the show today.
Thank you.
It's wonderful.
Yeah, absolutely my pleasure. I'm always happy to talk about the science of regenerative medicine because it's something I'm very passionate about.
And we're having his number flash across the screen, as I'm sure the audience is reading right now. So if you have any questions, I'm sure you could call and find out more information if you're interested.
Yeah, thank you. The nurse practitioner in our office has been doing this for several years already. It's not a brand new thing for her. She's had lots of real life experience.
And there's a lot of different clinics that are getting into this now. So I'm glad the United States is catching on to this.
Yeah, you're right. It is becoming very popular in this country.
So, well, thank you, Dr. Egbert.
My pleasure.
It's been a pleasure having you on the show today.
Thank you.
All right. Hey, thanks for staying tuned for the Lezlie Show today. I do have to share something a little personal with you guys today. My husband's one of these guys that snores too much, and I never get any sleep. I'm always so tired. Oh my God, he's snoring. So I said, you know what? I said, you need to go to the doctor and get something for that snoring because I just can't take it anymore. So he went to the doctor, and he comes home, and I said, all right, great, you went to the doctor. What did he give you? And he goes, you know what? He gave me a set of earplugs so that way I don't need to listen to your bitching and moaning all night long. Anyway, enough about my husband. Don't ever let anybody take your mojo, and have a fabulous day. Bye now.